Okay, let's unpack this. Have you ever had that feeling, just tired all the time?
Mm.
Or maybe aches and pains you just sort of write off as, well, getting older?
Yeah.
What if I told you there's this common inherited condition that can quietly mess with your health for years, often looking just like those everyday things? Today, we're doing a deep dive into hemochromatosis. Basically, it's a condition where your body slowly, almost without you noticing, builds up way too much iron over many, many years. We call it iron overload.
Yeah, and it's definitely not just about feeling a bit off. If that iron buildup isn't dealt with, it can cause some really unpleasant symptoms. But more seriously, it can actually start damaging really vital organs. We're talking the liver, joints, the pancreas, and yes, even the heart. So understanding this condition, it's really crucial knowledge. It can genuinely help prevent some serious long-term health problems down the line.
Exactly. That's why this deep dive feels so important today. Our mission really is to explore those subtle signs of hemochromatosis, dig into its genetic roots a bit, and walk through the treatments that work. By the end of this, you should feel pretty well informed about this condition that honestly often gets missed. So, first things first. Who is most likely to be affected by hemochromatosis? What does the data show us?
Well, what's really fascinating here is just how concentrated it can be in certain groups. It most often affects people of white Northern European background.
Northern European. Is there like a specific reason for that link?
Yes, it's particularly common in countries with a strong Celtic background. Think places like Ireland, Scotland, Wales.
Oh, okay.
The thinking is this high concentration might be linked to something called a founder effect,
Right.
where a specific genetic mutation just became really common in those populations over centuries. It's quite striking, actually, how geographically specific it seems to be.
That makes sense. Okay, so let's talk symptoms then, because this is where it gets tricky, right? Where it hides, you
Yeah.
said they usually start between 30 and 60.
That's the typical window, yes.
And the symptoms themselves, they can be really subtle, easy to mistake for other things.
Absolutely. That's the core issue. We're talking about things like feeling really tired all the time, that date fatigue that just doesn't lift,
Mm-hmm.
unexplained weight loss, maybe just general weakness, joint pain.
Yeah, things you might just blame on stress or, a bad night's sleep.
Exactly. Most people probably would just shrug them off. But beyond those more common, easily dismissed symptoms, there are others, less commonly associated maybe, but really important clues.
Like what?
Well, for men, it can include erectile dysfunction and inability to get or maintain an erection. For women, things like irregular periods or periods stopping altogether.
Okay.
And then there are the cognitive or mood symptoms, which are maybe even more surprising for some people. Brain fog, mood swings, even depression and anxiety.
Wait, brain fog and mood swings. Things people often think are purely stress or mental health related
Yeah.
could actually point to iron overload.
It's possible, yes.
That's really eye-opening. It makes you wonder, doesn't it?
Mm.
How often are these things treated separately without any, connecting the dots?
It really raises an important question. How many of these symptoms that might seem unrelated on the surface could actually be linked back to one underlying cause like this? It definitely shifts your perspective on things.
Well, it really does. Okay,
Yeah.
so if the symptoms are so sneaky, when should you actually, pick up the phone? When should you talk to your GP about this?
Right. There are a couple of pretty clear triggers. First, if you have persistent symptoms or worrying symptoms that sort of line up with what we've discussed, especially if you have that Northern European family background.
That family connection is key then.
It's a huge clue, yes. And second, and this is really vital, if a parent or a sibling, a brother or sister, has hemochromatosis, even if you feel perfectly fine yourself.
So even with no symptoms, if it's in the close family, get checked.
Exactly. Don't wait for symptoms if you know there's a family history. Tests can check if you're at risk. I mean, if we connect this to the bigger picture, being proactive is everything. Talking to your GP about blood tests to check for hemochromatosis, well, early testing can completely change the outcome. It's that significant.
Okay, that's really clear. So let's say someone is diagnosed. What happens next? What does managing it look like? Is there a cure?
Well, there isn't currently a cure for the underlying genetic condition itself, but, and this is the really good news, there are very effective treatments. Treatments that can lower those iron levels right down and prevent damage.
Okay, good. So what are the main treatments?
There are two main approaches. The first, and the most common one, is called venesection. You might also hear it called phlebotomy.
Right.
It's basically a procedure where some of your blood is removed. It sounds a bit maybe medieval, but it's very safe and common.
Oh.
Initially, it might need to be done quite frequently, maybe even every week for a while, to get the iron levels down. Then, once things are stable, it usually drops to maybe 2 to 4 times a year, for life, generally.
Okay. And what's the second option?
The second option is called chelation therapy. This involves taking medicine, usually pills, that help your body get rid of excess iron. It's typically used only if venesection isn't suitable for some reason, maybe difficult veins or other health issues that make regular blood removal tricky.
Got it. What about lifestyle? Diet. Do you need to completely overhaul what you eat?
That's a great question. And the interesting thing is, if you're having regular treatment like venesection, you actually don't usually need to make massive changes to your diet to control iron levels. The treatment does the heavy lifting. However, there are a few specific things it's generally advised to avoid.
Such as?
Things like breakfast cereals that have iron added to them,
Yeah.
Fortified cereals.
Right.
Also, iron supplements, obviously. And interestingly, vitamin C supplements, too.
Vitamin C. Why is that?
Because vitamin C can actually increase the amount of iron your body absorbs from food. So it kind of works against what you're trying to achieve. And it's also generally recommended to avoid drinking too much alcohol, mainly because alcohol can be tough on the liver, which is already potentially vulnerable.
That's really practical advice. Avoid the fortified cereals, the iron and Vic C pills, and go easy on the booze. Makes sense.
Yeah.
Okay, let's peel back another layer then. To really get this, we need to look at why it happens. The genetics.
Yes, absolutely. It all boils down to a faulty gene. This specific gene affects how your body absorbs iron from your diet.
Okay.
Normally, there's a pretty sophisticated system to make sure you only absorb what you need, but with this faulty gene, that regulation system goes a bit haywire and you end up absorbing too much.
And how do you get this gene? Does it just take one parent passing it on?
No, the inheritance pattern is quite specific here. You're only at risk of actually developing the condition if you inherit one copy of this faulty gene from each of your parents.
Ah, so you need 2 copies, one from mom, one from dad.
Exactly. 2 copies are needed to have the predisposition for hemochromatosis.
Okay, so what if you only get 1 copy then?
Good question. If you only inherit 1 copy, you won't develop hemochromatosis yourself. But you are what we call a carrier.
Meaning?
Meaning you carry that one faulty gene, and there's a chance you could pass it on to your children. Which, again, underlines why knowing your family history can be so helpful. But here's where it gets really interesting.
Go on.
Even if you do inherit 2 copies of the faulty gene, it's not a guarantee you'll actually develop the condition or the symptoms.
Really? Why not?
Well, it's not known exactly why this is. Only a fraction, actually, of people with 2 copies ever go on to develop significant iron overload or symptoms.
That is fascinating. So having the genes doesn't automatically mean you get the disease.
Precisely. A genetic predisposition isn't always a guarantee. It shows there's still quite a bit we don't understand. Maybe other genes or environmental factors play a role in whether it actually, switches on.
It really hints at how complex our own biology is, doesn't it? Which leads us nicely, I suppose, to the stakes involved. What happens if it isn't caught? What are the potential complications?
Yes, let's talk about the stakes. And you're right to transition there because that genetic uncertainty makes early detection even more crucial.
So let's start with a positive, if it is diagnosed and treated early.
Right. The good news first. If hemochromatosis is picked up early and managed properly with treatment, it generally does not affect your life expectancy, and it's unlikely to cause serious long-term problems. That's a really hopeful message.
That is really good news. It really emphasizes getting tested if you're at risk.
Absolutely. But the flip side is significant if it's found later at a more advanced stage. Well, those high iron levels can unfortunately cause damage. And that can lead to some potentially serious complications. We're talking about liver problems. That could mean scarring of the liver, which is called cirrhosis, or even an increased risk of liver cancer in some cases. It can also lead to diabetes problems with high blood sugar. Arthritis is another one, joint pain and swelling, often in the hands. And even heart problems, like heart failure, where the heart muscle weakens and can't pump blood effectively.
Wow. So the damage can be quite widespread if it's left unchecked.
Yeah.
Liver, pancreas leading to diabetes, joints, heart.
Yes. It really underscores why awareness and early action are so important. Living with those kinds of issues, thinking it's just normal aging or something else, it's tough to think about when diagnosis could change things.
Definitely. And for people who are diagnosed or think they might be at risk, are there places they can go for support?
Yes, absolutely. There are patient organizations out there. For instance, Hemochromatosis UK is a well-known patient-run charity. They provide loads of information and support for people living with the condition and their families.
That's great to know. Having that community and reliable information must be invaluable. Okay, so let's try and sum up our deep dive today. Hemochromatosis. It's a genetic condition, it's manageable, but the key really seems to be early awareness and consistent treatment to stop those serious complications before they start.
That's it in a nutshell. Be proactive, listen to your body, know your family history.
So maybe a final thought for everyone listening to mull over.
Yeah, I think, what does this all mean for you personally? It kind of raises an important question, doesn't it? What other, maybe seemingly minor symptoms in your own life might be little clues? Clues to something more significant where getting knowledge early could make all the difference. It makes you consider the silent ways our bodies might be sort of working against us sometimes, and the real power that comes from understanding our own health, maybe even our genetic predispositions.
That's a powerful thought. It definitely encourages us all to think a bit more deeply about our health and, crucially, about our family's health history. That knowledge is just so valuable.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.